This is Starting the Conversation, and I'm Luis Gutierrez Mock. I'm with the UCSF Pandemic Initiative for Equity in Action. Today, we'll be talking about interviewing skills and building rapport, really thinking about setting the agenda and starting the conversation for contact tracing. Our learning objectives for the day are for you to be able to define active listening skills, to apply them to interviews, learn the steps to setting the agenda, and beginning the interview process itself. When we think about interviews and the contact tracing interviews, we have some key considerations. We want to first take a contact-focused approach to each call. It's really important. Each person who we're speaking with is unique in their circumstances and should be respected. We might think about this as saying, we're all in the same storm, but we're definitely not all in the same boat. Secondly, we want to think about our tone of voice, how information is conveyed, and how questions are asked really can help in building trust. Especially thinking about tone of voice because we're having a conversation on the phone with somebody, and really our tone of voice is the first thing that people are going to be able to pick up on. It can also be a lot of really hard, scary news. We're calling somebody who doesn't know us. We're trying to establish that trust and rapport right away. It's really important to try and understand the experience of the person who you're calling, the contact. Listen to their responses. And really thinking about finding ways to validate them and to show compassion. We'll talk a little bit more about that later. It's important to recognize that you're asking a lot of personal questions. The contact might not feel like sharing some of these questions. So in that case, we want to ask, really listen, and try to use some of the active listening skills that we'll be reviewing today to be able to elicit the information from the contacts. So I'd like to ground our discussion today about health coaching in a story by introducing you to Elsie. Elsie is one of the people on your contact list. She's 65 years old and immigrated from the Philippines when she was 14. Elsie was a middle school teacher for many years, and she recently retired. She speaks Tagalog and English. Elsie is pleasant when you speak with her. A couple of times she has to ask you to wait while she helps one of her grandkids get a snack. Elsie says she has a hard time keeping up with all of the news about COVID-19, and she finds the public health guidelines to be confusing. When you tell her that it's recommended that she quarantine for 2 weeks, she asks, well, isn't that what we're doing now? When you explain the difference between social distancing and quarantine, Elsie says, that's not going to work for me. My daughter needs me, or she can't work and pay rent. My neighbors depend on me to bring them groceries. I need to walk my dog. Thinking about Elsie's situation, can you think to yourself for a moment, what challenges does she face as she seeks to observe quarantine? What challenges do you notice? I think something like she has a lot of people depending on her. She's not sure that she can do this. She needs to take care of her dog. She has to help her grandkids. There's a lot of people who are really looking towards Elsie. We can reverse that and think about what strengths and resources Elsie has. Take a moment too to think about what strengths does she bring as she seeks to observe quarantine. And if you thought to yourself, she's got a really strong social network, you're right. She has a lot of people in her life who it sounds like would probably be a really great source of support for her. As contact tracers, we want to help our contacts identify the strengths that they have to bring in as they seek to quarantine so that they can be more successful. So as a culture, we can think of health coaching as an approach to talking with people that's client-centered, strength-based, and collaborative. So what does that mean? By client-centered, I mean meeting people where they are in the complex context of their lives and prioritizing their values and their concerns. In Elsie's case, she's the central support of a wide social network. Her daughter, her grandchildren, her neighbors, and even her dog depend on her. By strength-based, I mean that health coaching seeks to understand what people already know and what they are motivated to do, and to build on that knowledge and motivation. Elsie's expansive social network is also a strength as she seeks support for the period of quarantine. Being collaborative means engaging people as the experts in their own lives to figure out how to carry out complex behavior change. In your conversation with Elsie, you will bring knowledge about COVID 19 and quarantine, and Elsie will be the expert in her own life. And only by engaging her as an expert would we be able to reach a plan that would fit and work for her. So, as a skill set, we define health coaching as a set of tools to support people in gaining the knowledge, skills, and confidence to be active participants in caring for their own health. I'll be sharing some of those tools in the videos that you'll watch in just a few moments. So, health coaching has been researched extensively in chronic disease management and addiction. You might be thinking to yourself, well, what does this have to do with contact tracing? Evidence shows that health coaching tools are effective in supporting people in making difficult changes to their daily lives. Much like improving diabetes control or quitting smoking, adhering to a quarantine involves a lot of pretty significant behavior change, and it's not easy. It could require changing our physical space, it could require changing our social relationships, and then we also have practical barriers like whether or not people have enough food for 2 weeks and other supplies, or how they'll communicate with their workplaces about not coming in.